Muscular dystrophy. For the overview, muscular dystrophy is a group of disease that cause a progressive weakness and loss of muscle mass. Our muscle mass is the size of our muscle. It includes the skeletal muscle, the smooth muscle, and the cardiac muscle. In muscular dystrophy, abnormal genes or mutations interfere with the production of proteins needed to form a healthy muscle. Then the symptoms of the most common variety begin in childhood and mostly in boys. So muscular dystrophy comes in a variety of forms. The most frequent variety symptoms appeared in childhood and especially in boys. Other varieties don't show up till later in life. Muscular dystrophy has no cure, but medication and therapy, on the other hand, can help manage symptoms and reduce the progression of the condition. So for the rationale, MD is a term that refers to a collection of approximately 30 diseases that cause a muscular weakening and deterioration. It becomes more difficult to move as the illness worsens. It can impair breathing and cardiac function, putting one's life in jeopardy. The consequences of MD can be minor, developing slowly during a person's lifespan, depending on the kind and severity of the disease. It can also be aggressive, developing swiftly and shortening a person's life in some situation. At this time, there is no way to prevent or reverse this MD or muscular dystrophy, but different types of therapy and pharmacological treatment can improve a person's quality of life and postpone the onset of the symptoms. Hello everyone, I am Ibu Galoso from BSP2A and I am here to discuss the symptoms and causes, the treatment and diagnosis, and the conclusion of the muscular dystrophy. First, we have the symptoms. The main sign of muscular dystrophy is a progressive muscle weakness. So muscular dystrophy is characterized by a gradual muscle weakening depending on the kind of muscular dystrophy. The specific indication and symptoms appear at the different ages and in different muscle groups. So we have the different types of muscular dystrophy. First, we have this Dachshund type. This is the most common form. Although girls can be carriers and mildly affected, it is much more common in boys. So Dachshund MD is a disorder that primarily affects the boys and is caused by mutation in the genes that controls the dystrophin. What is dystrophin? Dystrophin is a protein that is part of a protein complex that works together to build and protect a muscle fiber from the damage. A protein involved in maintaining a muscle fiber integrity. It will be released in 5 to 8 years and is progressing quickly. By the age of 15 to 12, most males are unable to walk, and by the age of 20, they may require to use a respirator to breathe. Now let's go to sign and symptoms of this Dachshund type of muscular dystrophy, which typically appear in childhood, and this might include the frequent falls, difficulty rising from a laying position or sitting position, trouble running and jumping, wilding gait, walking on toes, large calf muscles, muscle pain and stiffness, learning disability, and delayed growth. So let's go to the second type. We have the Becker muscular dystrophy, also known as the benign pseudohypertrophic muscular dystrophy. Signs and symptoms are similar to those of Dachshund muscular dystrophy, but tend to be milder and more progressive slowly. Symptoms generally begin in the teens but might not occur until the mid-20s or later. So, Becker muscular dystrophy, or BMD, is a hereditary disorder that causes a skeletal and cardiac or heart muscle weakening and atrophy. Males are the ones that are most affected. Muscle weakness commonly appears between the ages of 5 to 15. Heart involvement or cardiomyopathy is sometimes the initial symptoms. BMD is inherited in an X-linked recessive way. This X-linked recessive inheritance is a way A genetic trait or a condition can be passed down from the parent to child through the mutation or the changes in the gene of the X chromosomes. So this is the symptoms of Becker muscular dystrophy. So we have also other different types of muscular dystrophy. Some types of muscular dystrophy are defined by specific features or by wherein the body symptoms begin. Example is the myotonic muscular dystrophy. This is characterized by a inability to relax muscle following contraction. The facial and the neck muscle are usually the first to be affected. People with this form typically have long, thin faces, drooping eyelids, and a swan-like neck. So, myotonic and the patients also exhibit lengthy faces and saging eyelids as well as frontal baldness in men. So this is the example. Alright. The frontal balding, the cataracts. Now, let's proceed to the other type of muscular dystrophy, which is the facioscapulohumeral or FSHD. So, muscle weakness typically begins in the face, in the hip, and shoulder. The shoulder blades might stick out like wings when arms are raised. Onset usually occurs in teenage years but can begin in childhood or as late as age of 50. So facioscapulohumeral MD is a condition that develops in adolescence and causes progressive weakness in the facial muscles as well as some arm and leg muscles. It is a slow progressing disease with symptoms ranging from mild to severe. So these were the examples in humans. And this. Now let's proceed to the congenital muscular dystrophy. This type affects boys and girls and is apparent at birth or before age of 2. So some forms progress slowly and cause only mild disability, while the others progress rapidly and cause a severe impairment. So congenital muscular dystrophy or CMD is a term used to describe a group of muscular dystrophies that appear at shortly after birth. So muscular dystrophies are genetic degenerative disease that primarily affect the voluntary muscles. So babies born with congenital muscular dystrophy are born weak and may have breathing or swallowing problems. So better supportive care has increased survival in recent years. And pharmaceutical studies of disease-modifying medicines aren't far behind. Now let's move on and go to the next one. We have the limb girdle. The hip and the shoulder muscles are usually affected first. People with this type of muscular dystrophy might have a difficulty lifting the front part of the foot and so might trip frequently. Onset usually begins on the childhood or the teenage years. So limb girdle muscular dystrophy refers to a group of disorder characterized by the muscle weakening and atrophy in the arms and legs. So the muscle nearest to the body are the most impacted, particularly the muscles of the shoulder, the upper arms, the pelvic areas, and the thighs. So the severity, beginning age, and the characteristics of limb girdle muscle dystrophy differ among the different subtypes of the disease. And even within the same family, signs and symptoms can emerge at any age and often worsen over time, though they may remain moderate in certain cases. So we are done with the symptoms of muscular dystrophy. Now let's go to the causes. So the cause is certain genes are involved in making proteins that are protect muscle fibers. Muscular dystrophy occurs when one of these genes is is defective. Each form of muscular dystrophy is caused by a genetic mutation particular to that type of disease. Most of these mutations are inherited. So, risk factors for muscular dystrophy affects both sexes and people of all ages and races. However, the most prevalent type, the Duchenne, affects mostly young boys, and people with a family history of the disease are more likely to develop it or pass it to their offsprings. So let's go to the treatment and diagnosis. First, we have this treatment. Although there is no cure for any form of muscular dystrophy, treatment for some forms of the disease can help extend the time a person with the disease can remain mobile and help with heart and lung muscle strength. Trials of new therapies are ongoing. So people with muscular dystrophy should be monitored throughout their lives. Their care team should include a neurologist with the expertise of neuromuscular diseases, a physical medicine and rehabilitation specialist, and a physical and occupational therapist. So, some people might also need a lung specialist or pulmonologist, a heart specialist, a cardiologist, a sleep specialist, a specialist in the endocrine system, and orthopedic surgeon, and other specialists. So, treatment options include medication, physical and occupational therapy, and surgical and other procedures. So, ongoing assessments of walking, swallowing, breathing, and hand function enable the treatment team to adjust treatments as the disease is progresses. So, we also have different diagnoses. So, your doctor are likely to start with the medical history and the physical examination. After that, your doctor might recommend this diagnosis. First is the enzyme test. So the damaged muscle release enzyme, such as creating kinase or CK into your blood in a person who hasn't had a traumatic injury. High blood levels of CK suggest a muscle disease. They can also use the diagnosis of genetic testing, the muscle biopsy, the heart monitoring test, the lung monitoring test, the electromyography. And for the conclusion, muscular dystrophy is a skeletal muscle illness characterized by progressive muscular atrophy caused by an X-linked gene mutation in the Duchenne muscular dystrophy gene produce a shortage of the skeletal muscle protein dystrophin, which causes the skeletal muscle breakdown. As previously stated, muscular dystrophy is caused by a lack of essential proteins that are required for muscle structures and action. So several types of MD are caused by a lack of protein called the dystrophin. The majority of the time, it increases the muscle function. Muscular dystrophy is more frequent in boys since it is X-linked. So, eat balanced diet, drink a lot of water to avoid dehydration, and constipation. Exercise as much as possible. Keep a healthy weight to avoid obesity. Quit smoking to protect your lungs and your heart, and obtain flu and pneumonia vaccines to prevent this muscular dystrophy. So, how can a student aid this treatment of muscular dystrophy? So I think we have to encourage students to engage their muscle whenever practical and appropriate. Encourage the learner to stay active as possible in order to maintain a healthy muscle for as long as feasible. Adopt physical education, exercise to allow students to engage. For example, by using a lift weight equipment. So, I think that's all. I hope you've learned something about this muscular dystrophy, and thank you for listening. Have a good day. Once again, I am Abel Galasso from BSP 2A. Thank you.